topic about trust in medicine. This is quite a topic and quite an adventure, especially for pediatricians who have enjoyed a large amount of trust with their clients and their patients over the years. And we've never really had to deal with lack of trust. It was very fringe for us. And I think the whole COVID experience changed that a bit for us. This is really about honoring physicians and honoring what we do, and yet trying to find our joy and sort of regain the trust in some of the reasons we came back to medicine. We have the pleasure and the honor of having Dr. Douglas Diekema speak to us today. He is MD, PhD. He's an attending physician and the director of education at the Truman Cath Center for Pediatric Bioethics at Seattle Children's Hospital. He's also a professor, Department of Pediatrics in the University of Washington School of Medicine. He earned his MD at the University of North Carolina, which I bet he's guessing he's going to be in that weather now, not this weather, and his master's degree at the University of Washington. He's board certified in pediatrics, as well as pediatric emergency medicine. His research interests include sports medicine, injuries to children and wilderness medicine, ethical issues that arise in pediatric practices. So quite a diverse interest. In his free time, as if he doesn't have enough to do, loves hiking, backpacking, camping, skiing, running, and photography. So sometime, Doug, you and I just did hang out for fun. Anyway, I'm going to hand it over to Doug. Doug, thank you for being here. Really appreciate it.
Yeah, thank you, Mike. And thanks everyone for joining. I know for many, the weather's made this a bit of a challenging morning, but it's good to see you all. And as Mike said, I am going to be talking about trust in medicine. And right now I'm trusting that you can see those slides. So let me know if you can't.
Yeah, we can see them, Doug. They're good.
Wonderful. So I was initially asked to do this talk by the Washington chapter of the AAP for their board meeting, and it gave me the opportunity to actually think a little bit more explicitly about trust. And I will say, as somebody who's been doing bioethics for some 40 years, I quickly came to realize that it's not actually a topic that gets explicitly addressed very often in our field, and yet the more I thought about it, the more I realized that it doesn't get the attention because people don't think it's important or not important, but rather it's just assumed to be so important that, as it turns out, it underlies a great deal of what we consider to be the ethical practice of medicine. And to give you two examples, for example, the very common notions of confidentiality and informed consent, and a great deal of what we do as physicians actually is rooted in trust and can really only be successful because of trust. And so, as it turns out, this is an underlying, almost assumed concept of importance. And so what I'm going to do this morning in sort of brief outline form is talk a little bit more about the importance of trust and the problem I believe we currently have, not simply in medicine, but also society, which is that trust is on the decline. And then I'm going to use vaccine acceptance as an example of that, and then use that as a way of talking about our three basic current approaches to the problem of vaccine acceptance and vaccine hesitancy and vaccine refusal, and why I think two of those undermine trust, and then talk about some elements of a way forward, which will be specifically related to the vaccine acceptance problem, but also have important implications for the rest of what we do, and how to maybe regain trust, and what some possibilities are for getting trust back. So we'll start with a definition. Trust has been variously defined, but a couple of good definitions are that trust is a confident belief in and a reliance on the moral character and competence of the other person, often a person in whom one has an intimate or established relationship. And that sort of definition is certainly one that applies to medicine, the medical relationship with patients. A confidence that another will reliably act with the right moral motives and in accordance with appropriate moral norms. Something I think it's fair to say that at least a trusting patient assumes will be the case in their physician. And then the sort of flip side of this, which is the character side, is the definition of trustworthiness, which is to warrant another's confidence in one's character and conduct. There's a reliability here that's important. Beecham and Childress, who have written what may be the most read and well-known of the medical ethics texts, the principles of biomedical ethics, have made the claim that nothing is more valuable in health organizations and contexts than the maintenance of a culture of trust. And I would tend to agree with that. Now, trust is central to much of what we do as humans. Humans, we're social beings, and we rely a great deal on trust in other people. And it's important to note, I think, that trust has a very close relationship to vulnerability. So the picture you're seeing here is an adventure I had several years back with my son, who's the person in the red coat in the front, when he was a teenager, and three colleagues who you see in the background there doing something that is a little more dangerous than what you might do at Disneyland. This took place on a route called the Ptarmigan Traverse, which is about 35 miles of mostly off-route adventure through the Glacier Peak Wilderness and the North Cascades National Park, about half of which is on glaciers, and in our case, featured some pretty horrendous weather as well. That is the sort of thing that requires absolute trust in your partners. Half of the time we were roped to each other. We were relying on each other to help make decisions and to route find and to keep ourselves safe on glaciers with huge crevasses and cliff sides that had the potential for a fall. The only way you can do that safely is if you trust your partners. And what I want you to note is that the centrality of that trust, the importance of the trust, increase many times as your vulnerability in the situation increases. We didn't need to rely on that trust a great deal when we finally got back to the final 5 miles on an established trail that took us exactly to where we knew we needed to go. But in that middle section, we really did need to rely on each other because our vulnerability was greater. And so it's in situations of vulnerability where trust becomes the most important. And I would argue that medicine is one of those. Patients who come to us are vulnerable in important ways. They lack the knowledge we have. They lack the ability to fix the problem they have without our help. And the very state of illness makes them vulnerable. The problem we currently have is that the public appears to be less trusting than they used to be. Trust in the medical system and those running medical institutions has dropped since the 1970s by several measures. Trust in public health leadership and institutions has also fallen during that time. Trust in vaccines has fallen, and that has the fall in trust related to vaccines has been particularly precipitous since the advent of the COVID vaccines, and I'll talk more about that. And the increasing influence of institutions with other agendas over public health and medicine, institutions like government, corporate medicine, and the influence of industry, I would argue, have all had a negative impact on the public's willingness to trust both public health and medical providers. It's important to notice that trust in medicine is no longer solely about the physician. When I was growing up in the 1960s and seeing my physician, that was medicine to us. It was your individual physician. You went to a small office where there were 2 or 3 providers. It was not corporatized. And you often knew those people because, at least where I was in a small town, I went to school with the kids of those physicians. We went to church with one of those physicians. We had relationships outside of medicine where we at least knew family members and others related to that physician, and our trust in that physician was quite great, and it really was related to the physician, him or herself. What I think has changed a great deal is that trust in the individual physician is now tied to other things. It's not only tied to medical science, and people's willingness to trust medical science and how we do medical science, but it's also tied to trust in the institutions to which we are now associated. And in 2022, most physician practices are now owned by corporate entities and have become much larger. And that means that if our families and patients do not trust those institutions, the insurance companies that fund their healthcare, the institutions that own our practices or own the places we work, then we will also sort of by default be a source of mistrust. And so many changes have diminished trust, I think, since the 1960s and 70s. As I mentioned, there's been a significant rise in physician practices having been corporatized. Physicians have less control over the decisions they make, which are increasingly sort of being limited by payers and institutions. Physicians are associated with institutions that have profit as a primary goal. And physicians also have relationships with institutions rather than, or patients have relationships with institutions rather than physicians. If you, in many cases, who they're interacting with between visits with you are actually the insurance company or the clinic or some sort of faceless entity. There have also been social changes, what I refer to as stranger care, the decreased continuity with a single patient. It's increasingly the case. I mean, I knew the 2 doctors in the practice I went to. I was going to see Dr. Cook or Dr. Norbeck, and I knew them both. In 2022, when I call for an appointment, it's not entirely clear whether I'm going to see the doctor I expect to see or not. And or whether they'll be available for a clinic visit, and it may be somebody I don't know and I'm not aware of, and quite frankly, I'm always shocked as an adult seeking care how little I know about the providers I'm having to pick, whether it's a urologist or a sports medicine physician or my own primary care physician. I'm frequently finding myself not knowing those people and seeing strangers to a great degree. There is no question that there's been sort of a rise in doubt about medical science, a rise in doubt about other things that sort of undergird what we do in medical practice. And the availability of information on the internet and on Google and the sort of notion of Dr. Google all have sort of undermined the science on which we rely, because many people now read disparate information about the recommendations we're making, and since the basis of our practice is often in medical science, and there are increasing sources throwing doubt on those sources, that creates a problem for us. And the reality is that patients trust those they know, family, friends, and even social media communities more than experts. And I, quite frankly, have witnessed this in my own family. I have 6 brothers and sisters, and the nieces and nephews that go along with that, and 6 of the 7 of us are, it's fair to say, aggressive pro-vaccination people, and I have one sister who is won't vaccinate herself and won't vaccinate her kids, and why is that? The truth of the matter is that the reason for that is that she is more trusting and closer to her social media communities, which is where she spends much of her time, and her friends who she spends hours with on the phone, than she is with her family, who she sees much less frequently and talks to much less frequently. And so even though one would think that she would trust her brothers and sisters, and her parents, the truth is that she has more trust in those people who she spends far more time with and who are feeding her disinformation, in many cases unbeknownst to them. They think it's true. So let me now, having made some preliminary comments, step back and talk a little bit about vaccine hesitancy and refusal. And I want to start sort of at the beginning with smallpox, which was known as the scourge of humankind. And I think most of you know that smallpox was perhaps one of the, if not the worst viral illness we have seen. It killed about 1/3 of the people who got infected with it, and it was one of the most infectious agents we have ever known. And so when smallpox would sweep through small communities, it would wipe out between 1/3 and 1/2 of the people who lived there, and it would leave many of the remaining members scarred because those pox lesions left permanent scars. One would think, in the context of smallpox, that the creation of a vaccine for a disease that deadly would be hailed as nothing but a gift from God. And that vaccine, which was far less safe than the vaccine we currently have, did prove to be effective. Jenner and Jesty were 2 of the individuals who were responsible for making the observation that if you inoculated somebody with the smallpox, or cowpox rather, that they would be immune to smallpox, and demonstrated this through a series of experiments, mostly involving children. What many people don't know is that smallpox inoculation was, despite the fact that it was demonstrated that it would keep you from contracting smallpox, and therefore not only save you from a good chance of death, but also the scarring that resulted if you survived. The inoculation was immediately met with opposition, and not just among the sort of common folk. It was met by opposition from scientists who were skeptical that this could work, and there was much opposition from the public. You can see in the picture here, which is a cartoon published at that time called The Cowpox, that and it's subtitled "The Wonderful Effects of the New Inoculation," which is being facetious, because as you can see, that the people surrounding this woman who's getting inoculated all have bovine features, and the cartoon was sort of designed to lead people to believe that if you allowed yourself to be inoculated with cowpox, that you would develop bovine features of some kind. And misinformation like this was propagated through the streets in the form of anti-vaccination pamphlets and demonstrators. Those demonstrations were organized. And I have to say that for something that occurred 200 years ago, the similarities to today and most recently what happened with the COVID vaccine are striking. It's as if no time has passed. And that there's, they didn't know how it was more understandable, I think, in the 1700s and 1800s that there might be some opposition because it wasn't understood how microorganisms worked, or even that they really existed, as opposed to being humors in the air, for example. There were not sort of modes of delivery of information that were as reliable. And if you think about a world without an internet, you would think that this kind of opposition would not spread. But demonstrations and pamphlets were highly effective in spreading this among the population, and it proved very difficult to get people vaccinated against smallpox. We had back then parents refusing to send their children to public schools when, about 20 years after the advent of the inoculation, there started to be requirements for people to get vaccinated, and many of those were tied to the public school system like they are today. Some parents would pull their kids out of the public schools and send them to private schools if they lived in a jurisdiction that didn't require private schools to vaccinate. Many parents moved to homeschooling, a move we've seen in 2020s. And some parents would go as far as to try to fake a vaccination scar. So with smallpox, rather than having a card, the COVID card that you carried around to prove your vaccination status, or a vaccination record, your evidence of vaccination was the scar on your arm where you got inoculated, because that inoculation would result in a single pock lesion that would then scar. And so you could tell fairly easily who had been inoculated and who had not. And so you had parents actually taking sharp objects and digging it into their kids' arms in an effort to fake that scar. Anti-vaccination leagues developed as early as 1870. So if you think the anti-vaccination movement is moderately new, you are wrong. They have been with us for over 150 years. There were attacks, physical attacks on public health officials. Many people sort of felt like the threats being directed at public health officials, like Anthony Fauci, were a novel thing that represented a major change in our society. Once again, that is not the case. This was happening 150 and 200 years ago in the days of smallpox. And then once we started seeing laws requiring vaccination, which occurred around the 1950s, or the 1850s rather, in many states, there were immediate attempts to repeal those laws, to roll them back. Many of those attempts were successful. Again, the kind of cycle that we see happening in the United States today, where efforts to increase vaccination requirements are frequently met with efforts to repeal or roll them back, sometimes those being successful as well. And 150 years ago, we saw a technique that we've seen in California related to pamphlets being circulated encouraging parents to find a physician who would provide such certificates to them without a true reason to not get vaccinated. And the primary difference between the 1850s and 2022 is the advent of the internet, where this becomes much easier for people to find out. And in fact, that is what happened in California when California strengthened their vaccination laws. Now, this is where I'm going to say some things that you may not all agree with. And I will say that I am not alone in making this observation. I've been studying vaccine hesitancy now for probably 30 years and writing about it. And over time, my thinking has evolved to some degree. And I have, and I will say that from an emotional perspective, I feel the way many of you feel about people who won't vaccinate their children. I get angry, and I often want to say things about those individuals that aren't very nice. But what I want to say is those feelings are valid, but I think we need to step back and look at what's going to be effective. And so while we may voice some of those things amongst ourselves, I think we have to be careful about saying some of those things publicly. Vaccine hesitancy is currently by many understood to be centered in individuals who refuse to vaccinate their children or themselves. And the sort of common understanding is that these are people with deficient levels of knowledge and understanding. They're easily misled by misinformers. They make poorly informed choices because of that misinformation or that lack of knowledge, and that increases their risk or their children's risk. Or they're making decisions based on emotions rather than data. And so when I look at my sister making those decisions on behalf of herself and her children with regard to the COVID vaccine, many of these things seem to ring true. And the proposed solutions when you take that approach are the solutions that many of us have used, which is we simply need to increase understanding by presenting the facts and the data and maybe speak in a louder voice than the misinformers. We need to increase understanding by challenging the data sources that these people have. And we need to force right decisions through mandates. And one of the things that I think the social sciences have taught us is that certainly those first two bullet points in the proposed solutions do not work. And they certainly haven't worked with my sister. And I have rarely seen them work with people who are who come into a visit, for example, opposed to vaccination, as opposed to somebody who's on the fence and truly looking for guidance. For somebody who has made the decision, it's highly unusual to change their mind. And one of the suggestions I want to make is that the part of the reason these solutions are not very effective is that the frame we're using is the wrong one in centering this on individuals who simply are knowledge deficit and fail to understand and maybe need to be smarter. When you take a closer look at what's going on with these people, it's not so much that they lack the ability to make wise and smart decisions, but it is really a problem of trust. And what I'm going to argue is that they don't trust the sources of information we trust. They trust the sources of information that are actually, in many cases, providing disinformation to them. The drivers of vaccine hesitancy, in my mind, at least in 2022, are very similar to what they were in the early 1800s with regard to smallpox inoculation. Fear is a major driver. Families are afraid. And if you pay close attention to people who are providing misinformation about vaccines, they play on fear. They make people worry about vaccines based on their ingredients and other factors. They're also, distrust is also a big factor here. As I mentioned before, and I think this cannot be overemphasized, people will trust the sources they trust. And those are often the sources that are providing support to them and providing some kind of positive attitude toward their own sort of views on life. And they will tend to distrust people who are different than them. And unfortunately, many experts have now become different than other people in a way that makes people distrust experts. And then disinformation is another driver that, as I mentioned before, plays both on fear and distrust. So when you look at, and this is just one of many studies that have been done, when you look at the concerns parents express about vaccination, many of them are rooted in fear. They're worried. They're worried that we're giving too many vaccines, that we're giving too many at one time, that vaccines cause fevers or that they cause other diseases, even when we have evidence that they don't, for instance, autism. That the ingredients are unsafe, that the vaccines have not been tested enough, that they cause disease. And I have heard that from people in my practice. I can remember taking care of a child with pertussis whose parent insisted that the reason her baby had pertussis was that she had been around other children who'd been vaccinated against pertussis. And you can sort of stop an analysis by saying this person just needs to be smarter about how vaccines work and how disease works. But the bottom line is that person has chosen to believe that because she trusts, or he trusts, the people who have told her that, and trusts them more than you. And therein lies part of the problem we have. So fear is a big driver here. And if we don't recognize that what's behind vaccine resistance in many cases is fear, and acknowledge that, we're starting off behind the starting line, too far behind the starting line. The main driver in my mind right now is distrust. And we have seen distrust in all of these entities increase over time. There is distrust in government. There's distrust in industry, and industry makes our vaccines. And there's no way around that. We have more or less moved from a situation where at least in the past, these were partnerships between a nonprofit academic mission and industry, and have now become very much industry products that are profit driven. There's a distrust in science and scientists, and a big part of that is because of who funds the work of those scientists and where their products end up, which is an industry. There's distrust in public health officials, in large part because they're an arm of a government that many people lack trust in. And finally, there is distrust in physicians and organized medicine now, in part because of our association with industry and with public health officials, or at least the perceived relationship that we have. And I'm not saying that these relationships aren't necessary and don't have important positive aspects, but what I am saying is this is what many people in the public see, and this is part of the reason that physicians themselves are now finding themselves not trusted by families. It's this association we have with entities that families may not trust at this point in time. And then the disinformation problem is one that is perhaps the toughest to tackle. And social media has made this infinitely worse, and made it far too easy to spread any information at all without any ability for most people who are using the internet as an information source to be able to parse out what is reliable and what's not. Increasingly, there are anti-government views expressed. There is anti-expert sentiment expressed, and the tainting of experts by association. And we saw that happen with Anthony Fauci as the spokesperson of the government. He was initially sort of revered by many as the calm and rational expert. And over time, largely because of the influence of social media and other media actors, many people began looking at him with more suspicion, not because it was deserved, but because there were views being expressed in social media, in many cases about things that were not true about Anthony Fauci, that led people to doubt whether what he was saying could be relied on, and that can become a problem. And then this notion that, all you have to do to research anything nowadays is to go on the internet, and it makes you as much of an expert as anyone else, is a very common belief, and one that seems to be difficult to eradicate. When I have looked back at the history of vaccine refusal and vaccine hesitancy, the one thing that has been striking to me is how little has changed since the early 1800s in terms of why people resist vaccination, the ways in which they do it, and the reasons they have for being suspicious. But the one thing that has changed is the politicization of vaccination. Up until about 10 years ago, I would commonly get asked by audiences whether there was a Republican or Democratic propensity to refuse vaccination. Was this related to the party you belonged to? And my answer was always no. The data showed that it wasn't, that you were just as likely to find individuals who consider themselves to be liberal refusing vaccination as those considered to be conservative. And oftentimes their reasons were different, but this was not a party issue. That has changed. This notion that somehow being anti-vaccine is tied to being pro-God and pro-prayer and pro-Constitution and pro-Republican and pro-President Trump and pro-QAnon is, first of all, absolutely absurd. It and never should have happened because there is no reason that vaccination should be tied to one political party or another, and yet it happened. And so we're now facing a world where one's political, in many cases, our family's political identities are a driver in whether they get vaccinated or not. And those political identities are also a reflection of who they trust. And this is just one chart that sort of shows that relationship. That what they did here was they looked at states based on by what margin they voted for either Donald Trump or Joe Biden in the last election. And then that is laid out on a grid with the other axis being how likely people were to, how likely they were to be unvaccinated, what percentage of the population was unvaccinated in those states that were red versus blue. And you can see there is a almost scary correlation here with lack of vaccination being far more common in states that are red than states that are blue. And that, by the way, is accompanied by increased death rates related to COVID in particular in states that are red. Likewise, if you look at our state and COVID, this is one that looks at COVID related deaths. You can see that the death rates are highest in many of our rural counties, and one can argue that maybe that's a reflection of lack of health care, but I think with the ease of an ability to transport patients in 2022, this is far more likely to be a reflection of anti-government views and a refusal to get vaccinated because of a lack of trust in established medicine and the government and what experts are saying. So how do we deal with this problem? How do we improve childhood vaccination rates in an ecosystem of distrust? The one thing I haven't mentioned is that it's not just the COVID vaccine where this has become a major problem. We've always had a trust problem with vaccination itself, and the onset of COVID and the COVID vaccine seems to have made it worse for all vaccines. I would suggest that at present, there are three general approaches to the vaccine hesitancy and refusal problem. We see all of these being used, and I'm going to make the suggestion that two of them undermine trust, and we should be careful about utilizing them to a great degree. The first is coercion. Now, remember that physicians themselves can't force people to get vaccinated. Without state authority, a physician can't treat or vaccinate without a parent's consent. And the only way to get around that is to involve state agencies when we think that a parent's decision places a child at substantial risk of serious harm, a threshold that's rarely met with routine childhood vaccination. And so the tool that has been reached for is the legislative approach, which is to have requirements for vaccination for school entry, which is something I strongly support. But the latest approach, which is where that approach becomes coercive, is to eliminate any personal belief exemptions. And because when you do so, you now put families in a position where they can no longer send their kids to school unless they do something that to them seems unsafe or distasteful. We have seen that legislative approach being used more broadly in recent years, up until about, up until California, about, what was that, 5 or 6 years ago. The only states that had eliminated personal belief exemptions were, somewhat surprisingly, Mississippi and West Virginia. And they have now been joined by Maine and New York and California. And I think there's one other state now, which I'm drawing a blank on. That strategy does, to some degree, increase vaccination rates, although oftentimes not as much as people think. It also greatly increases the number of medical exemptions that people successfully obtain, which is a number that shouldn't change based on whether you offer personal belief exemptions or not. But here's the problem with getting very coercive about this, and that is that any coercive effort is inherently disrespectful and increases distrust. There's no better way to get people to not trust you than to show them disrespect. And these laws are very disrespectful. They're telling people, we don't trust your judgment. We're taking this decision away from you, and you have to do this. And I'm not saying that there aren't times where that's appropriate and should be the case, but I think they have to be used very, very carefully, because they do undermine trust. And when in this case in particular, when the medical profession is seen as the driver behind those laws, that distrust rubs off on us. It's not just the government. They see the AAP lobbying, they see physicians lobbying for coercive efforts, and that distrust rubs off on us. My feeling is that efforts to improve vaccination rates should proceed in a stepwise fashion, and I don't think we've done any of this. Disincentives and barriers to vaccination should be eliminated. I don't think we have any business telling people they can't opt out of vaccination for religious or personal belief reasons until we've effectively eliminated all barriers and disincentives to vaccination. And that means making it as easy as possible for people to get vaccinated. As long as there's a copay associated, this is an issue for anybody who does not have very much money to work with. As long as families need to have one of the parents take a day off work to drive to the office during working hours, there is a barrier to vaccination. I will never forget my polio vaccine, which was done at the school. And I know there are barriers to getting vaccination done at the schools as well, related to resources. But if we're serious about this, that, quite frankly, is the best way to break down the barriers, is to bring vaccination into the schools for families that really have a difficult time making it to a physician's office to get vaccinated under the current schedule, which requires a lot of visits. Current requirements should be enforced. And so, once again, our answer in many cases has been to eliminate personal belief exemptions when in states where the law is not even being enforced to begin with. And so if you think about Washington State, we shouldn't be eliminating personal belief exemptions until our schools are actually requiring that people either have a declination form signed, or they have vaccinated their kids. And in many cases, neither of those is the case. The truth of the matter is that there are many schools where there are children who have opted out for personal belief exemptions and who have been vaccinated, but they also have a significant proportion of kids who are non-compliant with the law, and that's easily fixed. Current exemptions can be strengthened. I think it's important that it not be really, really easy to get an exemption. I think it should be almost as hard to get an exemption as it is to get your kid vaccinated. But we also haven't done that before going to the coercive approach in terms of eliminating personal belief exemptions. And again, our goal should be a minimal acceptable level, not total immunization. We're never going to get the entire population vaccinated. And so I think we need to recognize that what we're trying to achieve is some level of herd immunity and be happy with that, and tolerate some degree of exemption. We may not like that, and there may be some degree of free riding involved there, but the reality is that the more coercive you get, the more distrust develops. And we also see fairly forceful organization happening as attempts are then made to undermine our vaccination laws, which I think is a big risk. The second approach is the rejection approach, and this is one that I am not a big fan of, and that's where physicians just simply refuse to see families who will not vaccinate their children. And I know there have been many reasons given for doing this. I don't think any of them hold water. And quite frankly, a policy of rejecting these families does not benefit the individual patient. You've just told them they can't see, the best pediatrician in the state, which is, I'm sure, what all of you think you are. It also doesn't benefit the public health because it doesn't get them vaccinated. And it's unfair to others, meaning those who are still willing to see them and do the counseling involved and take the time to work with these families who now have more of them in their practice. And finally, it undermines trust in physicians and organized medicine when once again we use this sort of coercive and disrespectful approach with families. And so when one physician does this, it paints all of us as people who are disrespectful and people who can't be trusted. I would also point out that, I've always felt this way about authoritarian states, and we have lots of examples of that right now, is that people reach for coercion when they've failed to persuade people. And it's not only inherently disrespectful, but a lot of the distrust that results from those coercive approaches comes from the belief on the part of those who are being coerced that if they can't convince me to do this willingly, they're hiding something. They're not telling me the whole truth, which is why they have to force me to do this. And once again, it just leads to distrust. A trusted healthcare provider remains the best avenue for changing minds about vaccination. Asking families to find another provider because they won't vaccinate according to the provider's recommendation does not improve communication. And when families leave, it eliminates communication as an option. And I really think that is the approach we need to use. And I know most of us, this is our primary tool. And my suggestion is we need to sharpen that tool and use it more effectively. And I think to go back thousands of years to Aristotle, I think Aristotle really told us how to do this effectively in his little book called Rhetoric, which is really the art of persuasion. And what Aristotle said was that for someone to be an effective persuader, for someone to be effective in the communication and persuasion realm, they first of all need to be trustworthy. Aristotle said this 2,000 years ago. Their character needs to be one that others trust. Secondly, their message should be factually correct and logical. But this is the important piece that people miss. That doesn't mean you just throw facts and logic at people. What Aristotle said is, if you really want to convince them, your message has to resonate emotionally. It has to elicit a response to inspire action. Facts and data are not enough. And then finally, a clear goal or end has to be in mind, and it's pretty clear what that would be in the vaccination context. But it's the emotional piece that's really important. So what are some strategies? I think that, they're not going to work on everybody, but this is the place to start. Our first goal should be to understand our patients, not to judge them, to diagnose their resistance the way we would diagnose a disease. Seek first to understand. So what is it you're worried about? Tell me why you don't want to vaccinate today. I really want to understand. And then gently respond to concerns they may have. You want to be positive, focus on what you want for their child. This should not be about what we want as pediatricians. It should be what we want for their child, which is a subtle difference and not one we always convey effectively. You should always show respect. Once you start showing disrespect, you lose their trust. Be willing to compromise. The goal is not to win the argument, but to win them over. And I think telling personal stories is a very effective way to do this. This is how you get that emotional resonance into a conversation. You personalize it, you tell stories, and not necessarily stories that scare the daylights out of people, but maybe personal stories. I mean, for me, I had my daughter was at the age where she was eligible for the varicella vaccine when it first hit the market. And at the time, there were concerns about the varicella vaccine and whether it might increase the risk of shingles in the future, and a lot of unknowns attached to it. And I was quite anxious about whether I wanted to wait or have that vaccine given to my child. I'm willing to share that with families, and then explain to them why I eventually made the decision to vaccinate my child. Not only does it humanize me to them, but it also makes me more like them and makes them more likely to trust me. That vulnerability in sharing my story also increases their willingness to trust. What doesn't work is trying to convince someone they're wrong, posing a threat to their identity or worldview. And this is a challenge in a politicized environment. How do you convince somebody who believes that their identity is dependent on being anti-vaccine? Well, one way is not to threaten the underlying identity or worldview, but to convince them that, actually there isn't any real valid reason why, say, being a Christian or being a Catholic or being a Republican means you shouldn't vaccinate your child. Data and statistics alone rarely persuade people. They just don't. The denial of inconvenient facts also does not. I mean, the truth is we are dealing with vaccines that are imperfect. The COVID vaccine is one of the most imperfect. And I think the wrong approach is to pretend that the shortcomings don't exist. I think we need to be open with people about the fact that, what we know about the COVID vaccine is it is far more likely than anything to keep you from dying of COVID. That doesn't mean it will keep you from getting COVID, and it doesn't mean it will even keep you from spreading COVID, because it doesn't necessarily do that. But what it does do is it decreases the risk of death. But what I have seen in the rhetoric of many is an attempt to downplay the fact that, it actually doesn't totally or even very effectively prevent spread, or even keep people from getting COVID. They just don't get as sick. Well, we should be open and upfront about that, because people know we're hiding the truth, and it makes us look distrustful when we're not open and honest about this and transparent. And that's the same for absolutist language and simplistic solutions. Some vaccines are better than others, and we shouldn't hesitate to admit that when families are questioning us and pushing us on this. And all or nothing disputes are just ridiculous. I have to say that the arguments about whether COVID vaccine should be mandated and whether masks should be worn in public and so on and so on drove me crazy, because there was no nuance in those disputes. It was you either had to be mask on all the time at everything or never. And it polarized people, and there was this sort of underlying notion on the part of public health professionals and medical professionals that the public would not be able to understand the nuances. But I think that led to bigger problems, which is that it looked like we were hiding something because we weren't being honest about the fact that, well, maybe masks weren't really necessary when you were on your run outside, early in the pandemic, for example. And so I think, nuance can be a good thing and kind of make us appear to be more honest than when we're trying to be black and white. Appeals to emotion are more effective than appeals to data. And experts who share common values and who are similar to the parent in other respects are more likely to persuade. So finding common ground with your families is really important. That is the best starting place. What is it you share with them? What do you have in common with them? And that may be easier for some families than others, but it's important to find that point of common ground and emphasize those aspects of the issue that support the beliefs and identity of the parent and the family, as opposed to your own. As Peabody said, the secret to the care of the patient is in caring for the patient. And once again, I think that is our most important tool, far more important than lobbying to eliminate personal belief exemptions or refusing to see families in the office who won't vaccinate their kids. So hopefully I've given you something to think about. I think we have a couple of minutes left if there are questions or comments. I think there's, let's see, anything, and you're welcome to put that in the chat or vocalize them out loud. I'm going to stop the screen sharing. To what degree do you think the pain with vaccinations is playing a role? That's a good question. I think that's part of this, right? I mean, when you think about the drivers of vaccination, hesitancy, fear is one of them, and pain is a driver there. And people don't want to see their kids in pain. So quite honestly, if we could somehow figure out a way to administer vaccines painlessly, that would help some of our parents. I don't think there's any doubt about that. People do worry not only about pain, but they read things about how pain has long-lasting effects, and so they worry about whether this is going to traumatize their child. So not all parents, this is a big deal, but it is for some. And anything we can do to help that, I think, is important. To give you, I talked about the polio vaccine in my experience with that. What I didn't tell you was it was the best day of my life. Well, not my life, but it was the best day of the school year. Because it was the oral polio vaccine, and the way they administered it to me anyway was, and to my classmates, was they gave it to you on a sugar cube. And it was like, who gives you a sugar cube to eat? It was, I mean, it was great. We loved getting vaccinated, and we hoped we could get vaccinated every day because we got the sugar cube. So you make this a positive experience, and at least the attitudes of your patients change. We would not have felt the same way if it had been an injection. Anything else? Otherwise, we'll let people get back to work.
Thanks, Doug.
You're welcome.
Very nice to see you.
Yeah, likewise.
Have a good day.
Thank you so much, Dr. Diekema. I really appreciate you.
You're welcome.
Enjoy your day.
Yes, likewise.